In this video, I will speak about the antioxidant activity of honey. I am also going to explain the health effects and the risks associated with honey consumption. Hello world, I welcome you to researchyourfood.com. The mission of this platform is bringing food science to the consumers. I am Prashant. I am a food engineer and the founder of Research Your Food project. Let us first take a look at the antioxidant activity of honey. Honey contains different types of flavonoids and polyphenols which act as potent antioxidants. Darker honeys generally tend to have more antioxidant activity as compared to lighter honeys. We add table sugar, that is sucrose, to sweeten many types of foods and beverages. It doesn't have any antioxidant activity and it contains empty calories. We can replace table sugar with honey in a good number of cases. Honey provides the sweetening effect along with its unique flavor and the added benefit of its antioxidant activity. In a research study done at University of Illinois, buckwheat honey with water was compared to black tea for its antioxidant activity. It was found that the antioxidant activity of buckwheat honey was considerably higher. Now, let us look at the effect of honey consumption on diabetics. Number of research studies done using diabetic rats as subjects resulted in the reduction of blood glucose level when they were fed with honey. Research studies done to find out the effect of honey consumption on human subjects with diabetes found mixed results. Some studies found that honey can reduce the blood glucose levels. It was also reported that honey may modestly reduce the weight and blood lipids in diabetic patients. Some research studies did not report any positive influence on blood glucose levels with the consumption of honey. Some studies even found that the consumption of honey can increase HbA1c level, which is an indicator of unhealthy control of blood glucose levels. Research data is inconclusive about the positive health effects of honey in diabetics. I would suggest diabetics to consume honey rarely and in moderation to avoid any complications. Now, let us look at the application of honey in wound healing. In the modern world, the rise of several antibiotic-resistant bacteria has become a serious problem. These antibiotic-resistant bacteria infections can pose serious problems both economically and otherwise in the treatment complexity. In general, people with diabetes are more prone to foot ulcers. In some cases, uncontrolled infections even lead to amputation. The statistics of the diabetic foot ulcers leading to amputation are alarming. It is estimated that every 30 seconds, someone in the world undergoes an amputation due to diabetic foot ulcer. Several research studies reported that honey has antimicrobial properties. Some researchers tried to heal foot infections by using honey dressing. In a study done in Egypt, complete healing was achieved in 43.3% of the total subjects with diabetic foot ulcers. In the other 43.3% of the people, the size of the wounds was reduced significantly. In 6.7% of the subjects, there was no improvement. Multiple other studies also positively suggest the effectiveness of honey as a wound healer. More research needs to be done in this regard to establish the facts. Honey was used in a few trials to reduce the cough in children. The trials included children from the age of 12 months to 18 years. The effect of honey was compared with over-the-counter medications, antibiotics, honey-based cough syrup, placebo, and no treatment. Honey was effective in relieving the cough symptoms better than no treatment, placebo, and an over-the-counter medication diphenhydramine. Honey may also reduce the cough duration better than the placebo and salbutamol. Though this study presents preliminary evidence that honey may alleviate the symptoms of cough in children, there is a need to conduct higher quality and large randomized clinical studies. Now, let us look at some of the health risks associated with honey. Though honey is natural and sounds very healthy, it contains mostly sugars. It also provides a lot of calories. If we are not conscious about it, we may add up quite a bit of calories to our diet. People with pre-diabetes, diabetes and metabolic syndrome must try to restrict the use of honey, as it is full of sugars which can spike and crash the blood glucose levels. Few components such as pollen in honey can cause allergic reactions in some people. Though it is rare, it can be very dangerous in some cases. If you are allergic to pollen, it would be better to avoid honey. Infants under the age of 1 year should not be given raw honey, as it could contain the toxins produced by a bacterium called as Clostridium botulinum. This bacterium produces neurotoxins that can be lethal. Thanks for watching. At Research Your Food, I create content related to food science and nutrition. This video is a part of the Food Science and Technology series. If you have any questions, let me know in the comments section. I will try to answer those questions. To get the latest updates about our videos, consider subscribing to our YouTube channel and follow researchyourfood.com website. You can stay in touch with us through our social media channels. I hope to see you in my next video.